Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Tiko Umaroh by the name 311090094. Okay, I will retell the article plasma cell gingivitis. Plasma cell gingivitis is an uncommon inflammatory condition of uncertain etiopathogenesis. Plasma cell gingivitis clinically characterized by diffuse gingival enlargement, erythema, and something desquamation. Plasma cell gingivitis include typical gingivostomatitis, idiopathic gingivostomatitis, allergic gingivostomatitis, and plasmacytosis de gingiva. The diagnosis requires hematological screening in addition to clinical and histopathological examination. Pathological changes in this condition are clinically similar to those of pemphigoid, desquamative gingivitis, lichenoid, or allergic reaction. Anti-seizure such as galantin or calcium channel block, hyperplasia, and a leukemic infiltrate, which must be differentiated through hematological and serologic testing. From this article occurs the case report. This case report concerns plasma cell gingivitis in a 15-year-old female caused by the use of herbal homemade tooth powder. The patient had neither relevant medical history nor any history of mouth breathing. However, her oral hygiene history was significant, revealing a recent use of herbal tooth powder made at home. Clinical examination revealed severe inflammation of this gingival tissue extending from the free gingival margin to the mucogingival junction in both the maxillary and mandibulary arches. Okay, this is figure 1. This is a preoperative view. Gingival enlargement grade 3 in the maxillary and mandibulary anterior sextant. The anterior tissue was pricked very red, moderately thick and edematous, which profuse bleeding on gentle manipulation. And this is figure 2. The gingiva is in the posterior region of both arches, was relatively less edematous. Blood tests result revealed total leukocyte count or TLC and differential leukocyte count or DLC within normal limit. Okay. However, red blood cells or RBCs show mild anestosis with hypochromasia. 3 categories of plasma cell gingivitis have been proposed based upon the etiology of the condition. They are number 1, lesion caused by an allergen, and number 2, neoplastic lesion, And then the last, number 3, lesion of unknown cause. Okay, differential diagnosis of this condition is similar to those of pemphigus, pemphigoid, desquamative gingivitis, lichenoid, or allergic reaction, anti-seizure or calcium channel blocker hyperplasia, and a leukocyte infiltrate. The latter needing to be differentiated to hematologic and serologic testing. Once the diagnosis of plasma cell gingivitis made, the screening of various antigen substance must be done. The case presents here the patient had switched to an herbal toothpaste fabricated at home and consisting of alum, black pepper, black salt, and ajwain. The case present here highlight the adverse effect and irrational use of herbal dentifrice. This case also illustrates the need to explore of patient individual background and habits when several possible etiology again. Okay, thank you. Wassalamualaikum warahmatullahi wabarakatuh.